Know your culture. You could say that the lens in our glasses is culture. And what is culture? Well, that's tricky, but the United Nations Educational, Scientific and Cultural Organization, UNESCO, provides a good definition. Culture may be said to be the whole complex of distinctive spiritual, material, intellectual and emotional features that characterize a society or social group. It includes not only the arts and letters, but also modes of life, the fundamental rights of the human being, value systems, traditions and beliefs. It is culture that gives human beings the ability to reflect upon themselves. It's through culture that we discern values and make choices. When it comes to culture, one of the most invisible gorillas in the room is the idea that silk culture should be frozen in time. Here's what medical anthropologist Wayne Worry has to say about this common misperception. To understand the difference between a view of culture as static or as fluid is to take the first step in understanding Aboriginal peoples. Otherwise, Aboriginal culture can be seen as something belonging only to the past and cultural change taken as proof that Aboriginal peoples have assimilated. Aboriginal peoples do not want to go back to the past, nor do they have to. They have never left their culture. Traditions change, but culture endures. Mainstream healthcare itself is cultural in nature. For a silk person, entering a doctor's office can be like entering a foreign country. A silk person is more likely to take a holistic view of healthcare in which all four elements of life, the physical, emotional, mental and spiritual, are woven together to support a healthy person, family and community. In contrast, here are some of the perspectives embedded in the culture of mainstream health. Physical, emotional and mental health requires separate health professionals and separate treatments. A person's spiritual well-being is largely viewed as irrelevant. Their health a patient's role is to be cooperative and compliant. Knowledge is scientific and is proven through Western forms of research. Know your power. An uncomfortable fact about cultural safety is that it challenges established power relationships. Many of us within the dominant society, white, educated, employed, are unaware that we occupy positions of privilege. Think about situations in which you may have experienced a lack of privilege, or maybe you've seen this at work in the lives of your family and friends. Perhaps you or someone you know has a visible disability and gets treated a little bit differently. What cultural safety asserts is that only by becoming aware of your own position of power within society can you begin to develop equitable relationships with Aboriginal patients, but in which biases and power imbalances are not perpetuated.